I think I want to start, of course, with the coronavirus, but specifically on the human toll this is taking. We have more unemployment reported, more to come, I'm afraid. We also have the disease itself and even the deaths. And you've talked about the situation in the state of Illinois. And we talk about these terrible numbers, but in fact, they are disproportionately hitting people of color, African Americans and particularly Hispanics.
We started asking the question when people came in and said they were infected, took down the information, and we found that disproportionately African Americans, now Hispanics, are coming up with dramatically larger numbers than we expected when it comes to the illness. A friend of mine back home put it well, I thought. He said, this coronavirus is not going to break us, but it's going to teach us about what's broken in America. And what's broken clearly is our healthcare system. We've got to reach the point in this country where everyone has access to affordable, quality health care. We certainly don't have that at this moment.
Can we do that in time to really address the issues here? Is this for the future?
It's more for the future, but we can start acting on it now. I spoke to Dr. Redfield yesterday at the Center for Disease Control and Prevention, and I said we need health care workers in the neighborhoods of Chicago, and Doctor, I can point them out to you. We need people knocking on doors and talking to people. If we're going to bring this infection under control, this virus under control, that kind of healthcare investment is going to find the people who have the most susceptibility to developing this infection and spreading it, and stop them from doing that. Teach them the kind of conduct that's going to be good for them and good for all of us.
There is the healthcare aspect of this. It's first and foremost a personal tragedy. There also is the economic effect as we see so many people out of jobs right now. Are you sympathetic, Senator, to President Trump's instinct to say we need to get the economy going again to give these people's jobs back?
Oh, definitely. There's no question about it, but we want to do it in a smart way. Your previous segment here talked about when the American people are ready to return to the economy. That's an important thing. At this point, there's a skepticism. We don't believe that we've won this battle completely. We believe as a nation we need to keep fighting. You know, we've gone through a terrible experience here. We've done it one time. We don't want to do it a second time. Let's get this right. Let's not reopen too soon. Let's pay a tribute to those healthcare workers who risk their lives every single day and show some sacrifice on our own part, too.
There's talk now about the Democrats on both sides of the Capitol Hill working on a new round of support for the U.S. economy. What is essential in that new round when it comes?
Well, there are several things that I think we ought to keep in mind. The early investments we made of $2.7 trillion are unprecedented, but they were really geared toward the economy moving forward starting on July 1st. That's when the unemployment benefits start to end, at least the federal boost. That's when we see an end to the small business loans that are being forgiven. But I think that's an optimistic scenario. Most of us understand that the problems aren't going to end as of July 1st. We'll be lucky if we start to really turn the corner by then. So we can't get weak-kneed at this moment. We've invested in this economy to avoid a depression. We have to continue to do that. I would put additional investment in helping state and local governments through this difficult period. I would certainly do my best to help the healthcare workers with hazard pay. We definitely need more testing. That is the key to reopening the economy. Those are the starting points.
So at some point, we're going to have to pay for all of this. We heard from Larry Fink yesterday of BlackRock saying that he thinks that corporate taxes are going to have to go up. Is he right?
I don't want to get into that conversation at this moment. At this point, we're trying to stabilize the patient, for goodness sakes. Let's not talk about the long-term care issues, and we know that we will have to face them. But if we don't do this right, if we decide to give half a dose of medicine to the American economy, we're going to plunge into a depression which is much more costly than anything that's being envisioned.
So, Senator, the coronavirus and the response to it is not the only thing on the Senate agenda right now. There's also a nomination for the D.C. Circuit of Judge Justin Walker, a district court judge out in Kentucky. Could you please explain what the problem is with this nomination, and frankly, why is it being taken up right now?
Well, you ought to ask Senator McConnell that question. He reconvened the Senate, brought us back with our staff and all of the people that keep this Capitol building running. You would expect that he would focus on the #1 issue facing America, this national emergency, this public health crisis. He wanted to focus on a 37-year-old federal judge in Kentucky that he wants to give a promotion to. It's an embarrassment. We should have been here doing the business of the people, which means addressing this great danger and threat to America, not some political favor he owes somebody in Kentucky.
Is the problem with the merits of the nomination? Is it with the overall redoing of the federal courts of appeals across the country, which has been going on for some time now? Or is it just a question of we can't get to it right now, we should come up later with that once we've dealt with the pandemic?
I can answer that question very simply. The vacancy this man is supposed to fill does not occur until September. Until September. And we had to come back here at some risk to the health of our staff and people who are working here so that Senator McConnell can keep his promise to this friend of his in Kentucky. The fact of the matter is he wants to fill every vacancy at any cost, and he proved it this week.
Last question, Senator Durbin. In terms of getting the next round of support done, is it important to start with the Senate Republicans so you have some bipartisanship, or can it start on the House side with the Democrats?
It starts with Speaker Pelosi this next round, and she's working on a proposal that we'll see in just a short period of time. I'm not certain when. I've heard a little bit about it. And we're going to sit down, of course, with Mr. Mnuchin, the Treasury Secretary. And I've got to say, I've been told he's a great negotiator and a good person to sit down with. He doesn't give in easily, but he looks for a compromise. That's what we're looking forward to.